My pleasure now to introduce you to John. Now, I've noticed something here, John, that you and Carl from the Brompton, or the Royal Brompton, are both wearing ties. Is this because of the part of London?
No, I'm just trying to be smart.
Yeah?
It's a Sunday.
Yeah, yeah. So, John, as I said, I'm going to get you to introduce yourselves, but it's a privilege to have you. So this is the third time you've been here as well, isn't it?
I think so. Second to this place,
and then one
in Manchester.
One in Manchester. Yeah. So, behave yourself. You've got half an hour.
Okay, thanks very much. Yeah, thanks, Ian.
You wanted to use these as well. You've not really given any explanation to these, so you're using these.
Yeah.
Can I just say, when you came in, you were given a clicker pad, and I know John's going to use them in his presentation. We are going to use them a bit later in the question time, and in Paul Corris's question time along lung transplant. So you're going to need access to these more or less at the beginning, aren't you?
Beginning and at the end.
Yeah. So you've got a number of buttons on here. You can't really get them wrong, apart from I'm looking at Julie Royal at the front, and already she's looking really perplexed. She's a Manchester City fan, so she is very confused at the moment. This is the click. So you need access to this for John's part as well.
Exactly. Thanks very much, Ian. It's a real honour to be invited again. I'm John Wort from the Brompton. I work with Carl. Lucky me. And I've been asked to talk to you about exercise, and this is a first for me. I've not talked about exercise before, although I do talk a lot about exercise. In fact, I sort of go out of my way now to talk about exercise because I think it's really important. And the outline of the talk is I want to just talk a little bit about the facts about exercise in people with PH, how to get going, how to start exercising, and then how to keep going. And we've known that exercise has been important for a long time, of course. You know, the Greeks used to roll around on the floor wrestling, and they had their marathon, not the chocolate bar, Carl. And we've got some examples here, actually. Some early examples. We've got the early treadmill here, the early static or stationary bike, and of course, boxing's been known for a long time, so the punching bag. And when I was growing up, there were some sort of well-known champions of exercise, and anyone recognise these? The Wombles, yeah. So, and here they are going out for their walk on Wimbledon Common. Anyone know this lady? Jane Fonda. So she was another big champion of exercise. I don't know how that foot can be in that direction. I just don't understand that. But of course, leg warmers were very popular in those days, weren't they? So I'm not telling you. Anyway, first question. So for this device, how many people in the audience do regular exercise? And that's once a day, once a week, once a month, or not at all? And I think I have to press this for the clock to start. So we've got 10 seconds. Off you go. You don't do any exercise. We know your answer. Okay. Oh no, we've got a bit more time. What do I press now? I click again. I've clicked again. Okay. So most people exercise once a day, followed by once a week, and quite a lot, a fifth, not at all. So I think that's important. We're going to try and address that if we can. Moving forward. Right, I think I need to go back one. So what do we know about exercise in people with pulmonary hypertension? So there have been about 29 studies and about 800 people overall, and but only about 6 of them are what we call randomized control trials. So they're the trials where they've got the highest quality, if you like. You're comparing exercise to a group not exercising. And there's a variety of settings. There's the inpatient stay, outpatient stay, and at home, and I'll talk about that a little bit in a while. This is the only graph I'm going to show you. I apologise, but I had to show one graph being a doctor. This is the 6-minute walk distance here, and this is the time in weeks. And then the complete lines are what they call the primary training group. So they're the people who were doing the main part of the exercise program. And these dotted lines here are the people who weren't. They were just getting their drugs and nothing else, no encouragement to exercise. And the first 3 weeks were done as an inpatient, and I'll tell you a little bit about what exactly they did in those 3 weeks. And then 12 weeks were at home with some constant encouragement and exercises to do. And then these control group, who didn't do the exercise, were then given the exercise. And what you can see very, very clearly is these exercise programs enabled these people with pulmonary hypertension to walk a lot further over that period. And I think if to put that into context, if you take all the studies looking at exercise, the average increase in walk test was about 60 meters. Now, if you compare that to the average improvement with drugs, it's about 30 to 40 meters. And the average improvement in 6-minute walk test that we think is relevant, although that is obviously very subjective, and I apologize for saying that, but that's about 20 to 30 meters. So you can see how important exercise can be in terms of improving the 6-minute walk test. Nearly all these studies also show an improvement in quality of life. So people were given quality of life questionnaires, various questions about various aspects of quality of life, and they all improved. And I've added these other two things here, that exercise is also known to reduce anxiety. And also exercise can aid weight loss. And if you lose weight, you can exercise more and you can feel better about yourself. So it improves well-being. So I was going to talk a little bit more about these exercise programs that they use. There was this inpatient stay, or the Heidelberg model, because most of these studies were performed in Germany, and they actually committed these people to a 3-week stay in hospital. Obviously, we couldn't do that in the NHS. It's hard enough to get into hospital, and when you're in hospital, they want to get you out as quickly as possible. But in Germany, you can stay 3 weeks in hospital, and they can give you sort of a sort of concentrated exercise program, followed by this period where they keep a very close eye on you when you're at home. The other method is an outpatient, where you're given classes about 2 to 3 times a week over 6 to 10 week period. And that's sort of similar to pulmonary rehabilitation classes, if any of you have done those. And then only a few studies have looked at actually what you can do primarily at home, which I think is something that we really need to work on. And I wanted to highlight this bit at the end, that physiotherapists have an incredibly important role. They are the centerpiece, if you like, to all these studies and all promoting exercise moving forward. So this is this Heidelberg model. This Heidelberg's very lovely, as you can see. I've never been there, but you can imagine it's nice to go and walk in the hills here and along by the river. And this 3-week inpatient stay. So what did it consist of? Well, every day for those 3 weeks, you were asked to get on a bike at low thresholds. It's not actually a lot, 10 to 35 minutes a day, increasing the intensity slowly. And then 5 days of the week, you were asked to do 1 hour of walking with mental training. Now, mental training, I think, means that someone was behind you saying, faster, faster, faster. Don't stop. 5 days of dumbbell training, 30 minutes. So that's just with a dumbbell, just exercising against the force of the dumbbell. So that's what we call resistance training. And then 5 days respiratory training. And this seemed to be quite important. This is where you do respiratory exercises, blowing against those devices or just against pursed lips. So that improves the muscle of the intercostal muscles between the ribs and also the diaphragm. And that was shown to be really important, actually. If you didn't do that bit of it, you didn't do as well. And also included things like yoga. So exercise with yoga also was important and was part of their program. And then they had 12 weeks at home. And with that, you were asked to do 5 days, again, of about 15 to 30 minutes of bike work a day. So that could be like 10 minutes in the morning and 10 minutes in the evening. 5 days of respiratory and dumbbell work, 30 minutes. So again, doing these respiratory exercises and doing the resistance exercises. And then 2 walks per week. But you haven't got that person behind you going faster, faster. So you have to do it yourself, although you could enlist one of your family members, I expect. The really important thing of all these studies is exercise is safe. And I know it's a real worry for people with pulmonary hypertension or a lot of chronic illnesses is it safe to exercise? It is safe to exercise. I mean, these were studies and therefore people were monitored quite closely. You have to have to be in a study. But there were very few problems and very few of those were down to exercise. So exercise is safe. However, there are some words of caution, of course, and we always say this. You shouldn't be lifting weights, heavy weights, and straining, because that is bad for you. Don't exercise if you're unwell. You know, if you've got a cold, a fever. That's true of anybody. And don't exercise if you're getting chest pain or feeling lightheaded. But it is normal to feel breathless when you exercise, and I'll come on to that in a minute. So here are 5 reasons why exercise is good for you from these studies. Number 1, the heart. So some of these studies have actually shown that the heart beats stronger after these exercise programs. The cardiac output, the amount of blood the heart is pumping, increases when you've done exercise. The second is skeletal muscle. So the muscle becomes stronger and it also becomes more efficient at getting oxygen out of the blood when you exercise. We've talked about the lungs already. So exercising improves the muscle strength in the muscles between the ribs and the diaphragm below, which help the lungs work better. And it also means you feel less breathless. This is really intriguing. There's one study showed that pulmonary hypertension might actually get better. And this might be because some of the chemicals that are released with exercise can actually counteract the chemicals that are causing pulmonary hypertension. So there's only one study that's shown this, but this is really interesting. And of course, finally, and very importantly, it can make you feel a lot better. So what can you do about it? Well, I think obviously you need to, with all these things, if you know more about it, you're more likely to do it. So learn more about it. And there are some good information on the PHA website. And I'm going to show you some clips of some videos that are available from the PHA in a minute. Know your level. It's important to know where you are now so that you can then proceed in a realistic way. And think the long game. This is a lifestyle change. It's not just for this week or next week. It's for the rest of your lives. So this is about taking control, you know. So knowing your level, there are sort of 3 levels, I think. There are people at the top who are already exercising now and they're going to the gym and they're swimming and they're doing long walks. That's great. That's a great place to be in. There are people who are active but not exercising. They still can go to the shops. They can do their housework and gardening. And perhaps their goal is to get to that top level. And then there are a lot of people who are sedentary, mainly based in the house, walking short distances. And I think that's where hopefully we can help you to improve on the amount of exercise so you can shift up the level. So busting the myths, I've already said, exercise is safe. It won't make your pulmonary hypertension worse. In fact, it might even make it better. Exercise need not be expensive. And we all think about expensive gyms. You don't have to go to an expensive gym to exercise. Local clubs and societies can have sessions where you can exercise. There is the pulmonary and cardiac rehabilitation with the NHS, if you can get on one, and that's something that we might talk about. There are these online resources such with the PHA, and walking, of course, is free. And being breathless when you exercise is okay. And I just want to show you now a clip from one of the PHA videos, which just talks a bit about breathlessness and breathlessness whilst you're exercising.
So imagine that we're going to go for a walk. And we're going to start off really, really, really slowly, almost as if we were walking down the aisle in a church at that really slow pace. And you're not going to be breathless. We're just walking down the aisle very gently and very slowly. We might increase our pace a little bit. So we're in kind of wandering around the shops territory. You're walking slowly so that you can see what's in the shop window, and you're stopping from time to time to have a look at something that interests you. And again, you're walking and you're active, but you're probably not breathless at that point. If you increase the pace a little bit again, then you might be walking at a gentle walk for you, and it'll be different for everybody. And at that gentle walk pace, again, you are not breathless. You're walking at a pace that's comfortable for you. You might get tired after a while, but you're not breathless. And all of these are absolutely fine, but they're not exercising. You're being active, but you're not exercising. If you increase the pace of your walk to the next step, beyond that gentle walk, you might start to feel that you're a little bit breathless. And that's fine as well. As you're a little bit breathless, but you could still have a conversation. So I might be walking along beside you and we could still be chatting, but we're just going to catch our breath here and there and have a little bit of a chat, but be a bit breathy while we're doing it. That is perfect. That's the pace that you want to be working at. That's how breathless you want to be. And that means you're exercising, you're training your body. It's not your pulmonary hypertension. It's not a problem. It's not a symptom. It's a good place to be if you want to exercise. If you walk a bit quicker than that and your breathing gets harder and it becomes a bit more laboured and talking to me is hard, then you're working too hard and you need to slow your pace back down again to that easier pace where you were a little bit out of breath, but you could still have a conversation. And if you walk even quicker so that you're gasping for your breath and you're struggling to catch your breath, then you really are working too hard. And you need to stop and rest and recover your breath and then start again at a slower or gentler pace. So by thinking about it in terms of that gentle walk and that slightly quicker walk and that place where you are, where you're a little bit out of breath, but you can still have a conversation, that's the place that you want to be if you're exercising. And if you feel like that, then you can know that it's safe and that it's okay and that you can carry on doing your exercise. And if you get any more out of breath than that, then that's the time that you need to slow down or stop.
Great. So that was Carol, one of the physiotherapists from Sheffield, and Paige, one of our patients. I think that was a nice way of describing exercising and feeling breathless. So how do you start? Again, I can't stress that you need to know your level. You need to know where you start from, and don't start too quickly. Be realistic, and if possible, involve other people. You're more likely to do it. You're more likely to be motivated if you're doing it with other people. That could be your family or your friends, or part of a patient group, and certainly part of the pulmonary capillary or rehabilitation classes. And don't just think about it. So I'm just going to show you another video now I'm cheating, of course. I'm getting everyone to do my work for me. But this is about some of the simple exercises that you could start doing, especially if you're in that lower level.
In this section, we'll look at exercise and two different types of exercise. The first is getting fitter, so making sure that your heart and lungs can work more efficiently. And the second is about strengthening your muscles in your arms and your legs. These activities can be completed by any person of any ability and can be done in your own home at your own pace in comfortable surroundings. Sit to stand from a chair is a great exercise for strengthening your legs. If you start off in an upright sitting position, not leaning backwards to the back of the chair, and push up through your legs, you can repeat this exercise as many times as you can before you start to feel breathless, and that will help increase the strength in your muscles. To make the exercise more difficult, you can cross your arms over your chest and stand up from this position rather than pushing up from the arms of the chair. This is another exercise that can be done at home, and it helps strengthen the bicep muscles in your arms. This exercise is best done in standing, but if you're unable to stand for long periods of time, you can do it sat in the chair. Make sure if you're sitting in the chair, you sit at the edge of the seat with your back straight and your shoulders relaxed. You can use any object around the house as a weight for this exercise, including cans of food or water bottles. Starting with the object in your hand, straighten your elbow and bring it up towards your chest. Repeat this exercise as many times as you can, making sure you do the exercise in both hands. Continue to breathe regularly throughout the exercise and try not to hold your breath.
I was just going to say, I forgot to warn Julie that I was going to show that. Thank you very much for that. You also see the difference between Germany and the NHS, where they had dumbbells, we have baked bean cans. But anyway, there we go. It's important to mix it up. So when you're doing your exercises, try and do an even amount of the three types of exercises. So I've already said that, resistance exercise, it's resistance against a baked bean can or a dumbbell. This is, Ian's very good at this. This is yoga. He's at a very high level and can do this exercise. But yoga is, seriously, yoga is or Pilates is very important for improving core strength and balance. And this is what we mean by aerobic. So walking, jogging, being on an exercise bike. I'm not quite sure what that is. Is that cross-training or something? I'm not sure. But anyway, it's important to mix it up. This is what resistance training is not, being resistant to exercising. So how much should you exercise? Well, I think to be honest, as much as possible. The NHS recommend about 150 minutes a week for anybody. And I think, you should try and aim for that. And that's about 20 to 30 minutes a day or 2 lots of 10 minutes. Think of it as a lifestyle change. I know I'm sort of repeating myself a bit, but it's really important and it can actually be enjoyable. I quite like this little cartoon here. I've been working on my core, said the pair. People like technology, or most people like technology, and this can really help. So quite a lot of people have Fitbits, and there are nice programs on their phones. You can even do a 6-minute walk test on the phone if you want to now, using the GPS device. And this sort of monitoring of one's steps can actually motivate people. And many of the trials that are being performed now are actually looking at this type of activity rather than just looking at 6-minute walk test, because it's more relevant. You come to a clinic like once or twice a year, you do a 6-minute walk test. You might not be feeling very well that day or can't be bothered. Whereas a series of steps over a longer period is much more relevant to us and you, of course. And then pulmonary rehabilitation classes, well, if you can get on one, and one of the problems is, of course, that they were designed for people with COPD, the respiratory ones, and if you haven't got COPD, sometimes it's difficult to get on one. But I think with a bit of persuasion, it is getting easier, and also with the cardiac rehabilitation classes. Anyway, they're free and they're run by the NHS and they're monitored, they're safe. And also you have educational aspects in those sessions, and also there's a social aspect as well. And it can then give you an individualized exercise program. So this is sort of a suggested approach that I've sort of come up with. It's not complete by all means, but it starts, of course, with you having to make the decision that you want to exercise more. It's up to you. That bit's up to you. And that's helped by you understanding that your condition and understanding the benefits of exercise. But you've got to make that decision. And then you can talk to us, to your nurses, to your family, friends, say you're going to do it, and then they can give you the support. And I think every person with pulmonary hypertension should have an individualized exercise program. That's what we've got to aim for. You should ask us, can I have my individualized exercise program? And we'll say, what's that? But it's going to come. We need to do that. And that might start, and I think it probably should start, with a monitored sort of environment in a rehabilitation class to give you the confidence to know what you can do. But by all means, start now and look on the websites for these online sources. Mix it up, do a bit of each of aerobic, resistance and core, and please keep going. How to keep going? Well, as I just said, you need to understand your condition and to understand the importance for you to keep going, to be motivated. Get the support from your family, friends and the medical team. Your individualized exercise program has to be realistic for you. and involve other people in your exercise, actually doing the exercise. So, in summary, in the wise words of the Wombles, exercise is good for you. It won't make your pulmonary hypertension worse. It may even make it better. It is safe. Know your level, learn about exercise and get going. Pulmonary rehabilitation classes are a great place to start, and use the online information available, for example, with the pulmonary hypertension, and keep going. So, the second question, after that, anyone persuaded? How many people in the audience will now try regular exercise? We've got once daily, once weekly, once monthly, or you're not persuaded. Off you go. Just remember, you might hurt my feelings if that 20% doesn't. Okay, I think that's it. Oh. There we go. I leave you with an early example of core training.
What on earth was that there?
Exactly, I don't know what that is, but anyway.
Anyway, so do as the doctor says, not as he does. But you are an exerciser. Just a couple of things, John. I mean, and it's very, very practical things that. I mean, it's been refreshing in a way to have a medic talk about pH and treatment without mentioning a drug, which is really good. Because, I mean, we often know, and we know in clinical practice, that drugs are only part of... There's no drug that makes you better on its own, is there? No. Not in pH. So it's about that ability to do stuff. And I'm thinking about, targets where the PHA can campaign, etc. We spent 20 years trying to fight places like NHS England about access to drugs. But what we want to do in the next 5 to 10 years is about the actual facility of a pH centre. What should be included in that. And do you think, where would you place physiotherapy now? I mean, you said... and a physiotherapist must be crucial, desirable.
Crucial. I really think every centre should have a physiotherapist that is sort of dedicated to help develop these individual training programs to sort of help people make this lifestyle change. Mm-hmm. I think it's absolutely crucial because you've seen, of course, you need the drugs. I'm not saying you don't need the drugs, of course, but the improvements are dramatic. Not only for how far you walk, but how you feel and your quality of life, obviously, is the paramount.
Mm-hmm.
Paramount.
Mm-hmm. And with that in mind, that you were saying about every patient ought to be given an exercise prescription. Is that pie in the sky stuff? Or do you think that is really quite possible?
Absolutely. I mean, all this stuff that you can do is most of it's free, and you can do it, and the benefit in terms of being better and not being admitted to they'll save money. That the NHS will save money, and therefore
you showed, didn't you, on the slide where about the average improvement on a walk test with a new drug is about 40 metres.
With a drug about 30 to 40 metres.
And then with exercise, it's around 60.
Average is about 60.
Yeah. So why is it that we're in a health service, in a government, no colour there, that we will invest in drug, but we'll not invest in things that we know makes...
It's cheap.
It's cheap. It is something we will campaign for and lobby for. We've been very interested as an organisation, working with a couple of groups like the Cystic Fibrosis Trust, the HIV organisations, muscular dystrophy, systemic sclerosis and those sorts of things, where their services have improved, and they've got masses of resources, and the PH service always seems to be the Cinderella one, that we struggle to get enough doctors and nurses to do the service, whereas organisations like the Cystic Fibrosis have been very good at securing long-term specialist centres with 3 and 4 like nutritionists, psychologists, and all those that the people here battle with all the time. And that's the area that we it's not just about drug, and I think that keeps coming back to it. It's just that it's so bloody expensive, the drugs. Anyway, that's not me, thankfully, this time, is it? No. I did that a few weeks ago in a very embarrassing meeting. I told everybody to turn the phone off my rain. Yeah, I mean, it is that, and possibly, this sort of thing could be. This is Carl, isn't it? This, really, yeah, on one of his weekend retreats. Yeah, in the forest. That's where I've seen it before. It's that website, Carl, you sent.
Carl's
by
website.
mistake.